Okay, so I'd like to invite the next speaker, Dr. Susan Yu-Gan, who I think is from the Philippines, talking on biphasic insulin aspart is safe and effective in Filipino patients with type 2 diabetes, results of a 12 weeks open label, non-randomised, non-interventional and observational multi-center study.
Okay. Good afternoon. The title of my paper is Biphasic Insulin Aspart is Safe and Effective in Filipino Patients with Type 2 Diabetes mellitus. Results of a 12-week open-label, non-randomized, non-interventional, and observational multi-center study. As mentioned, this is a multi-center, open-label, non-randomized, non-interventional, observational study to evaluate the safety and effectiveness of biphasic insulin aspart 30 for the treatment of diabetes mellitus. Our primary objective is to report major hypoglycemic events, minor hypoglycemic events, and nocturnal hypoglycemic events or serious adverse drug reactions during 12 weeks of treatment with biphasic insulin aspart. Secondary objectives include weight change at the end of the study, percentage of patients reaching target HbA1c, and fasting plasma glucose at the end of the study, and mean FPG at the end of the study. A total of 1,661 patients were put on the biphasic insulin aspart arm. However, 43 withdrew from the study, and we had only 1,618 patients at the end of the trial. The baseline characteristics of the patients: mean age was about 55, more females than males. The mean BMI of the patients at baseline was 25 kilograms per meter squared. The mean duration of diabetes was 7 years. The mean HbA1c was 10%, and mean fasting blood glucose level was 234.9. Majority of the patients were on oral antidiabetic agents, 81% of them. The reasons for shifting patients to biphasic insulin aspart was given as follows. Most of the physicians wanted to improve the fasting blood glucose as well as the HbA1c. We already have about 419 patient years of treatment with biphasic insulin aspart. So far, only one adverse event was reported, and this was community-acquired pneumonia, which was unlikely related to the study drug. No serious adverse drug reactions have been reported. Our primary objective in this study is to look at hypoglycemic episodes. There were no major hypoglycemic episodes reported during the study, and at the end of 12 weeks, we had lesser minor hypoglycemic events compared to the baseline. At baseline, there were 421 events reported, and at the end of the trial, 393 events have been reported. Nocturnal hypoglycemia was noted at 126 events, or 3.3%. There was a reduction in the HbA1c of minus 2.8%. So from baseline of 10.1, the HbA1c of the patients on biphasic insulin aspart dropped to 7.3 after 12 weeks. So that there were about 23% of patients who were able to achieve an HbA1c of 6.5 or less, compared to only 2% at baseline. There was also a change in the fasting blood glucose level. There was a drop of 97 milligrams per deciliter. However, there was a small increase in the body weight. From a baseline of 64.9 kilograms, the weight increased to 65.3. The mean dose of Biphasic insulin aspart was 33.3 at baseline, and at the end of the trial, the average dose was 38.8. So in summary, we were able to show that there is reduction in HbA1c so that more patients are able to reach the target. There was improvement in fasting blood glucose. There was reduced minor hypoglycemic episodes, and there was only a slight weight gain. Comparing this study to previous other studies, we will show that we get the same results. So in conclusion, biphasic insulin aspart was safe and effective with reduction in HbA1c as well as fasting blood glucose. There was low incidence of hypoglycemia and only a slight weight gain in Filipino patients with type 2 diabetes receiving biphasic insulin aspart. This is our disclosure. Thank you for your attention.
Paper's open for questions. Perhaps I could start by asking you, what was the primary aim? What do you think you learned from this that we didn't already know from other trials? I mean, it's a large study, but what do you think we know now that we didn't know before?
We would just like to see the profile of the Filipinos, whether the reaction to the medication is the same as in other races.
Is the reason to think it might have been different?
And also to prove that the drug was safe and effective.
You don't have a control group. So when you say less hypoglycemia, that was against what?
Against the baseline. Before they were started on biphasic insulin aspart, the reported hypoglycemic events were more than when they were shifted to biphasic insulin aspart.
That sounds a little bit interesting to me because a large proportion of your patients were on oral agents alone,
yes.
And when they improved their glycemic control, the hypoglycemia was less. That's interesting.
Yes, this was also, we didn't expect the same, we didn't expect this finding also.
Another, just for my interest, is the biphasic was twice daily?
Twice daily, yes.
Can I just ask you about the body weight slide? I went past fairly quickly, but...
Which one?
0.4.
The one on changes in body weight.
Oh.
Were the numbers on that smaller than... So we only seem to have about 600 people with body weight data, but there were about 1,600 or more in the study.
So there were 17 patients less. I think these were lost to follow-up.
Your beginning was 1,006.
It was about 1,600 altogether, and here you've essentially got... yes, the 17 less is the difference between baseline and follow-up, but weren't the 1,600 people at baseline?
Yeah.
Excuse me, Professor Chan, can I comment on this? Mm-hmm. This being an observational study, the data which is available of the patients was, for the weight gain, for example, what we can see here was only with 600 odd patients out of the total 1,600 which were given biphasic insulin aspart.
So does that mean the data were collected through routine clinical...
Yes, yes. This was observation study and data was collected in the routine clinical practice without any intervention.
So how does that impact on the measures of hypoglycemia? Does that mean that hypoglycemia was not collected in such a systematic fashion as might normally be done in a clinical trial?
We do not have the complete data on the others.
So I guess we have to be careful about talking about low rates of hypoglycemia in comparison to studies where hypoglycemia has been collected more systematically.
Yes, sir.
That's why when we are actually comparing in the last slide, wherein we are comparing with another observational study, that is improved study, we have actually collected the hypoglycemic data on the similar fashion there. and thus we are actually saying that it's on the same hypoglycemic incidence.
Okay.
Okay.
Further questions? Thank you very much.
Thank you very much, Dr.